Understanding colonoscopy, a comprehensive guide. A colonoscopy is a medical procedure that allows doctors to examine the inner lining of the large intestine, colon, and rectum. This procedure is crucial for detecting abnormalities such as polyps, tumors, inflammation, and ulcers that may indicate colorectal cancer or other gastrointestinal issues. Despite being a routine procedure, the thought of a colonoscopy can evoke anxiety or fear in many people. However, understanding the process, its importance, and how to prepare can ease concerns and encourage individuals to prioritize this vital aspect of their healthcare. What is a colonoscopy? A colonoscopy involves the use of a long, flexible tube called a colonoscope, which has a small camera and light attached to its tip. This device is gently inserted into the rectum and slowly advanced through the colon, transmitting real-time images to a monitor that the doctor views. The entire length of the colon can be examined during this procedure, which usually takes about 30 to 60 minutes. The primary purpose of a colonoscopy is to screen for colorectal cancer, which is one of the leading causes of cancer-related deaths. It can also be used to investigate symptoms such as chronic abdominal pain, rectal bleeding, unexplained weight loss, changes in bowel habits, or a positive fecal occult blood test, which indicates blood in the stool. Why is a colonoscopy important? A colonoscopy is the most effective method for detecting colorectal cancer in its early stages, often before symptoms appear. Early detection significantly improves the chances of successful treatment and survival. The procedure can also identify and remove polyps, which are small growths on the lining of the colon that can develop into cancer over time. By removing these polyps during a colonoscopy, the risk of developing colorectal cancer is greatly reduced. In addition to cancer screening, a colonoscopy can diagnose other conditions such as Crohn's disease, ulcerative colitis, diverticulosis, and infections. It is a versatile diagnostic tool that provides comprehensive insights into the health of the colon and rectum. Who should have a colonoscopy? The American Cancer Society recommends that individuals at average risk for colorectal cancer begin regular colonoscopy screenings at age 45. Those with higher risk factors, such as a family history of colorectal cancer, a personal history of inflammatory bowel disease, IBD, or a genetic predisposition to cancer, such as Lynch syndrome, may need to start screening earlier and have them more frequently. The frequency of colonoscopy screenings depends on the findings of the initial procedure. If no abnormalities are found, another colonoscopy may not be necessary for 10 years. However, if polyps or other concerns are detected, your doctor may recommend more frequent screenings, such as every 3 to 5 years. Preparing for a colonoscopy. Proper preparation is essential for a successful colonoscopy. The colon must be completely empty to allow for a clear view of the colon lining. Here's a typical preparation process. Dietary restrictions. A few days before the procedure, your doctor will likely advise you to switch to a low-fiber diet, avoiding foods that are hard to digest, such as whole grains, nuts, seeds, raw vegetables, and fruits with skins. On the day before the colonoscopy, you will need to follow a clear liquid diet. This includes water, broth, tea, clear juices without pulp, gelatin, and sports drinks. Red or purple liquids should be avoided, as they can be mistaken for blood during the procedure. Bowel preparation. The most critical part of preparation is bowel cleansing, which usually involves taking a laxative solution the night before the procedure. The laxative will cause diarrhea, ensuring that the colon is fully emptied. It's important to follow your doctor's instructions closely. Medication adjustments. Inform your doctor of all medications you are taking, including over-the-counter drugs and supplements. Certain medications, such as blood thinners, may need to be temporarily adjusted or stopped before the procedure to reduce the risk of bleeding. What to expect during the procedure. Upon arrival at the clinic or hospital, you will be asked to change into a gown. An intravenous IV line will be inserted into your arm to administer sedatives or anesthesia. Most people receive conscious sedation, which makes you relaxed and sleepy but not fully unconscious. In some cases, general anesthesia may be used, rendering you completely unconscious during the procedure. During the colonoscopy, insertion of the colonoscope, you will lie on your side on an exam table, usually with your knees drawn toward your chest. The doctor will gently insert the lubricated colonoscope into your rectum and slowly advance it through the colon. Inspection and polyp removal. The camera on the colonoscope transmits images to a monitor, allowing the doctor to inspect the colon lining for abnormalities. If polyps or other suspicious areas are found, the doctor can remove the polyps or take tissue samples, biopsies, for further analysis. Completion. Once the entire colon has been examined, the colonoscope is slowly withdrawn. The entire process typically takes 30 to 60 minutes. Post-procedure care. After the procedure, you will be taken to a recovery area where you'll be monitored as the sedative wears off. It's normal to feel some bloating, gas, or mild cramping as the air used to inflate the colon is expelled. Most people can resume normal activities the following day, but it's advisable to arrange for someone to drive you home, as the sedative can impair your ability to operate a vehicle. If polyps were removed or biopsies taken, you may experience minor bleeding or discomfort, but these symptoms should resolve quickly. Your doctor will provide specific instructions on when you can resume eating and taking your regular medications. Risks and complications. While a colonoscopy is generally safe, it is a medical procedure with some risks. Potential complications include bleeding. This is more likely if a biopsy was taken or a polyp removed. The bleeding is usually minor and resolves on its own, but in rare cases, it may require further treatment. Perforation. A tear in the colon wall is a rare but serious complication that may require surgical repair. Reaction to sedation. Some individuals may experience side effects from the sedative or anesthesia, such as nausea, dizziness, or allergic reactions. Infection. Though very rare, there is a slight risk of infection following the procedure. It's important to contact your doctor immediately if you experience severe abdominal pain, persistent bleeding, fever, or any other concerning symptoms after a colonoscopy. A colonoscopy is a crucial procedure for maintaining colorectal health and detecting early signs of cancer and other gastrointestinal issues. While the thought of undergoing a colonoscopy may be daunting, the benefits far outweigh the temporary discomfort. With proper preparation and understanding of the procedure, you can approach a colonoscopy with confidence, knowing that it plays a vital role in your long-term health. Regular screenings are key to early detection and successful treatment of colorectal cancer, making colonoscopies an essential tool in preventive health care. If you received value from this video, please like, subscribe, and comment.